Welcome once again to the Pre-Chiro podcast. My name is Dr. Ben Glass, and today I have the pleasure of speaking with someone who I actually met at chiropractic school many years ago, and he was more than open to come and share his perspectives with us today. And I just wanted to point out that when you go to chiropractic school, it really gives you the opportunity to make lifelong connections. So Omer, thank you so much for getting on the podcast with us today and sharing your insights with any prospective students around the world who are thinking about a career in chiropractic. Can we start off by you just introducing yourself and providing a little bit of your background, what you were doing before you went to chiropractic school, and what really attracted you to go and become a chiropractor?
Sure. Thanks. Thanks for having me, Ben. It's good to see you. It's been a long time. So my name is Dr. Omer. I'm a chiropractor, obviously. I live in Israel. I'm married. I have 4 kids. I was supposed to be a dentist. I went through 3.5 years of dental school out of 6. That's how they do it here in Israel. And around at the end of year 3 and kind of through year 4, I realized I don't want to be a dentist. So I dropped out. I did making sure I had all my prerequisites done. Told my wife that she's not marrying a dentist like she thought, but a chiropractor. And we moved to the States. My wife was 35 and a half weeks pregnant with our first son. So that was kind of the beginning. Early on, I realized, or I was exposed to what's called chiropractic neurology or functional neurology. And I think my second month of school, I started taking postgraduate classes for that program. Later on, because I had I had another child born, and so we had infants.
Hey, we're going to get really deep into your student experience and the different path that you took within the context of school. I was more curious what it was
what I do today.
How did you even figure out that chiropractic was a path, and what exposed you to it?
So I've been doing sports my whole life, and I have had many sports injuries, mostly sprains, and I was a weekend warrior. At some point, I was playing basketball every Saturday and then limping till Wednesday, and then repeat. And then my sort of brother-in-law, who's like my wife's brother from another mother, came to Israel for a visit, and he's a chiropractor. And on Thursday, he adjusted my ankle and my knee after I told him the story. And I then went ahead and played basketball for 3.5 hours, no problems, no limping. And I said, holy crap, that chiropractic thing works. And so I started seeing a chiropractor. And when that's kind of how I became aware that chiropractic does something to you. I didn't realize what or how. And later on, I was at a kind of a fork in the road trying to figure out what I want to do. And I decided there's 3 options, either be a medical doctor, a chiropractor, or a dentist. And what kind of steered me towards dentistry, like I said, was basically my dad is a dentist, and it's here in Israel. I had a serious girlfriend. I didn't want to move overseas and all that. So I kind of put chiropractic in the back seat. And fortune wanted me to go back to it. And so dentistry proved the wrong thing for me. And so we took the major leap and moved to California, to Life West. And that was kind of the end of the story. What I do today mostly is I specialize in functional neurology. And so I mostly see kids with developmental disorders. I have a fellowship in developmental disorders. And I see kids with autism and ADHD and OCD and dyslexia and whatever you want. Actually, just minutes ago, I had a 74-year-old lady with cerebellar ataxia come in, and we were working with her as well. So interesting cases. I also see your regular, back pain and neck pain patients, but I also see a lot of athletes and pregnant ladies and babies, and so
very dynamic practice. Yeah, like
Sorry.
it keeps it, I said it's a very dynamic practice and it keeps
Yeah.
life interesting when you're seeing
Sure.
all different types of populations. Can you speak a little bit about the program on functional neurology? What was it that attracted you to that? And like really give some details, right? We're trying to provide as much context for
Sure.
the functional neurology path within the
Sure.
context of chiropractic.
Well, so what kind of attracted me? I heard a little bit about it from my brother-in-law, who said these guys just do great things, and I don't know what they do, but it's really cool. And then my first week of school, we had so in chiropractic college they have clubs. So every lunch break, you get clubs with all different types of paths that you can take: sports, pediatrics, neurology, AK, whatever attracts your attention, whatever makes you excited. And during that first week, I think we had a video of this 17-year-old kid who had a car accident, and he was basically he was in a in hospital. His parents had already gotten the forms to sign off on him being disconnected from tubes and be ready to donate his organs. And they brought in this chiropractic neurologist. I forget his name right now. And he was there for like 2 hours, and eventually he got the kid to move his eyes on command. And then they realized, okay, there's somebody there. And then we saw a post of 6 months later, and the kid was in a wheelchair, talking, jesting, getting ready to graduate from high school. And it was really, really, really cool. And like 2-3 weeks later, they started a new program not far from the school. So I decided that that's an option. And the next month, I actually went ahead and started it. There are a few programs that teach chiropractic neurology, functional neurology. I think chiropractic neurology is not the right term, because there are a lot of people who are not chiropractors who are now learning this information and tools. One is the most known ones are the Carrick Institute, and then there's a course by functional neurology seminars that's offered through IAFNR. IAFNR is the International Association of Functional Neurology and Rehabilitation, of which I'm a proud member. The Carrick Institute is an educational institute. It teaches all different courses on functional neurology. And the way it works is you go, usually you do a weekend seminar. So it's either a 2 or 3 day weekend seminar. It's like from 8 o'clock to 6 o'clock. Very, very dense in material and clinical applications. And we go very deeply into the functionality of the brain and the different areas of the brain and how to test them, what they do, how you can affect them in different ways, not just through chiropractic adjustments, but through other sensory and motor and cognitive stimulations.
Mm-hmm.
There's nutritional aspects to it. There's chemical aspects to it. Some programs even go to the pharmacology of it. Not my cup of tea, so I'm not into that. But you can go into that and learn that a little bit. It goes hand in hand in many ways with functional medicine. So
Mm-hmm.
with blood tests and supplements and nutrition.
Mm-hmm.
But it's a very separate perspective and discipline, because we look very specifically at how the brain functions and how you can actually change the way the brain functions for better, hopefully, through non-pharmaceutical and non-surgical tools. And so that gives us an ability to help people with a lot of complex situations that nobody else has been able to help.
Right. Yeah, no,
Yeah. So
I've heard myself. I never actually went and did any functional neurology training formally, but I was at the club a couple times, and I would learn about how you could help people after a stroke. You could help people that
sure.
had brain trauma, which I guess is very common in car accidents. People don't
Or
realize.
football, soccer.
Or football, soccer, wrestling, concussions that people don't realize they've damaged their brain. And you're able to not only identify which part of their brain was damaged, but also help rehabilitate or help them regain functions that they may have lost or may have been damaged through the injury, the trauma, or just growing up with some sort of condition that maybe they developed.
Mentally.
Yeah, developmental condition. Can you speak a little more specifically on the different paths within the functional neurology umbrella that people can really specialize in or focus
Sure.
in?
The main ones are developmental disorders. That's the focus that I'm in. I teach it. I've been doing it for quite a while. Sorry. I would say the person who leads that and probably the biggest expert in the world in that is Dr. Robert Malillo, who's my mentor and my friend. Um, the other specialty, if you would, is TBI, so traumatic brain injury. Another kind of subspecialty is vestibular rehabilitation, and there's places where all those with those three kind of you can mix and match sometimes because TBI symptoms can sometimes be vestibular system, and vestibular symptoms can sometimes be because of a developmental disorder, and so there's it's not like very separate. There's interlinking and intercrossing. Um, there's also neurochemistry. So again, like I said, this goes hand in hand with functional medicine. So you can kind of learn the brain rehabilitation tools and then implement a lot of neurochemistry and functional medicine information and kind of throw that in there. And eventually, you'll have to kind of know everything slowly and surely. It takes a while. But those are kind of the main, I would say, the main ones.
Okay.
There's also pain management. So again, we're talking more systemic pain, chronic pain, stuff like that.
Mhm.
Um, I would say those are the main routes that people take these days.
What
Uh,
advice would you give to a prospective student to prepare themselves for one of those types of programs? Let's say they really are attracted to chiropractic school
mm-hmm,
because they want to become a functional neurologist and
mm-hmm,
they believe that chiropractic is either in alignment with their values, their beliefs. For you, it just sounded to me like I heard you said that it showed up on your radar through a family member,
yep.
and it was impressive to you how you could create so much change in such a quick way.
Well, for me, first of all, let me clarify that. For me, chiropractic and functional neurology are not separate things. Chiropractic is a it's an instrument. It's a way to look at things. And then functional neurology is just a way to understand the brain and rehab the brain specifically. So the way I explain it to patients is chiropractic is more of a so as a chiropractor, I'm more of a communication technician. So kind of like the guy who come like kind of like the cable guy. And then as a functional neurologist, I'm more of a computer technician. So I kind of go in there and try to actually fix the computer. And to get maximum, optimal functionality, you kind of need both. So that's just to clarify that. Um, and what they should focus on before they go to chiropractic college, I would say neuroanatomy. Be a whiz of neuroanatomy, and then and the biochemistry.
Mhm.
Those are the two things that I would say will give you the best basis for getting ready to go into the functional neurology world, because you will need both of them to understand what's going on. Because the brain is, you need to know the anatomy to know what's where, and
Mhm.
then if you have a good biochemistry background, it will be a lot easier for you to understand all of the neurotransmitters and all of the cytokines and all of the inflammatory processes that happen in the brain and how you can affect everything.
So how would a student find an office that was practicing functional neurology, or how would they get some like real world exposure? Do you know of any resources, or do you know of any places that have made it easy to find somebody that does what you do around the world? Or
Yeah, there's two main I'll say search engines for that. One is, like I said, IAFNR. So if you go to iafnr.org, iafnr.org, they have a doc locator there, so you
okay.
can find a doctor who's an IAFNR member. It's a membership organization. And then the other one is go to the American Board of Chiropractic Neurologists, so ABCN. They also have a doctor locator for people who are diplomates of uh, the ABCN.
Yeah.
Those are the best ways to do it. You can also usually kind of Google functional neurology, chiropractic neurology, and you'll find someone. Or they can always contact me, tell me where they are, and I'll try to help them find whoever they need. Um,
Thank you. Thank
yeah,
you for that. That's great. And it just shows that most chiropractors are willing to give back or willing to support the
for
next
sure.
generation, because it can
Sure.
be somewhat confusing to navigate the terrain if you're unfamiliar and you don't know where to look or who to talk to. Can you speak a little bit about, you said you were a fellow earlier. Can you speak
Yeah.
about what it took for you to get that title, and what the training was like, and what you came away with? What was like your major takeaways, and why do you value the education or the postgraduate education that you did?
Well, I'm a fellow of the International Board on Functional Neurology in Childhood Neurodevelopmental Disorders. That's kind of the full title, and that's a fellowship that's offered through the IBFN, the International Board of Functional Neurology, in cooperation with IAFNR. Um, and I decided to pursue this fellowship diploma, or whatever you call it, or certificate, um, mostly for myself, um, and a little bit for legality purposes. In Israel, it's a little different than in the United States, so I'm not going to go into it. But the diplomate status, like from the American Board of Chiropractic Neurology, doesn't kind of give me anything here, so I didn't bother to take that exam, although I can take it. I will explain how that works in a second. But the fellowship for me, because that's my main focus, was something that I wanted to do. So the way it works is you need to have a minimum requirements of hours that you have taken. So let's say a weekend course is 15 hours. To sit for your diplomate exam, you need 300 hours. To sit for your fellowship exam in childhood developmental disorders, you need a minimum of 150 hours. Um, and then you can also sit for a fellowship in functional neurology, and I can't remember if that's 150 or 300 hours. It's just different organizations who offer them.
Mhm.
I'm not sure of the legalities of what's what. Okay, so
Mhm.
I can't really remark on that. The way it works again is you do seminars, and then you go basically to your office and you start doing what you've learned, seeing what works, what doesn't work, and then you slowly progress, and you gain extra tools and more tools and more tools and more understanding as you take more and more courses. So the way I did it, around 2013, they started teaching these courses via live stream. Before Zoom and other things, they did live streams. So I started doing those because I was already living in Israel. And in 2014, 2015, I did 7 modules of three day weekends. Um, that was based in Montreal, but I was sitting at home at 6 p.m. to like 3 a.m. on a weekend,
Mhm.
um, listening in. And then I decided that it wasn't enough and I wanted to do it again. So I did it again in 2016 and 2017, and a course in Chicago at National University. And at the end of that, I decided I wanted to take that fellowship exam. So that's what I did. Um, and the main things I took from there, from all those courses, is I think maybe two things were the main things. One is the community of people who have taken these courses, and we have kind of created our own Facebook groups and WhatsApp groups, and you get people from all around the world that you can converse with, and you can consult with, and you can run ideas by. And for me, especially in the isolation here, because there's only like 2.5 people in Israel who do functional neurology, it's life saving sometimes. It's like oxygen. Um, and the other thing is just a whole lot of understanding of what I need to do to take a child and change his future. Take that child's family and change the way they operate, change the way they will operate for probably the rest of their lives. So that's kind of an understanding. When you see what these things do, it's kind of like, holy crap, I can do that.
Mm-hmm.
And that's just, again, that's kind of what drives you. And you need something to drive you, otherwise you get burnt out in any profession. So
How
you
would
need to
you
walk.
how would you describe the process that you take a child through, and also how you describe it to the parents? If I'm a parent and I'm learning about functional neurology, and coming from a chiropractic office, because I imagine you're adjusting the child in
Yeah,
addition to the different
for sure.
functional neurology tools that you have. Can you describe, like, in depth, some of the things that you're going to do, some of the things you're going to assess and analyze, and what
Sure.
that process really looks like?
So when first of all, I send the parents. I have a video, like a 30-minute video that I had prepared, that I'm explaining everything I'm gonna do in like 3 minutes. Now I take 30 minutes to explain it to the parents. So they come in and they already know a little bit of what to expect. They have a lot of forms they have to fill out, describing the child's development and and pregnancy and delivery. So we start really early, sometimes even before pregnancy. What's going on in their life? Do they have siblings? How's everything at home? How is everything in school? How are they in kindergarten? It's it's a lot of information. And then when they come in the office, I tell the parents there's two things I want to find out, and everything else I can find out is extra. One is, does the child have primitive reflexes that have not been integrated properly? And two, how is their tone, their muscle tone? Everything else is bonus. So I want to look at their eye movements. I want to look at their vestibular function. I want to look at their accuracy. I want to look at their if they have any hyperactivity or slowness or sluggish. I want to look at their motor function. I want to look at their sensory discrimination ability. I want to look at their spatial awareness. I want to look at their sense of smell. I want to look at their ability to pronounce. I want to look at their facial expressions. I want to look at their eye contact. I want to look at whatever they can give me that's going to give me information as to how their brain works, how their cerebellum works, how their frontal lobes work, how their parietal lobes work, how their temporal work, how their basal ganglia works, everything I can find out. So the basis, the beginning, is the primitive reflexes. Those are reflexes that babies are born with, and they're extremely important for their development, their motor development, their sensory development, their cognitive development, their emotional development.
Mm-hmm.
And they're supposed to slowly integrate into the system, into the nervous system, throughout the first year of life.
Mm-hmm.
And what a lot of times happens with developmental disorders is they don't get integrated. And then we can still see them even in adulthood. I just had a 74-year-old lady, like I told you, who has a developmental disorder. She doesn't have pathological reflexes, which is sometimes what we see after an injury, because there was no injury. So she probably has had this her whole life. So that was kind of cool to see. So first thing, we want to see if they have primitive reflexes, and then we want to start working on integrating them through exercises and some interventions that we've seen that work, like light or spinning or different sensory stimulation. And then we want to see how their tone is. Tone is where chiropractic comes in a most profound way, because what we work with is tone, is muscle tone. When we want to adjust someone, a lot of times we decide when to adjust, where to adjust based on their muscle tone, based on changes in their tone, be it if we do a leg check or if we palpate or if we do a muscle test. It doesn't matter. It's all tone. And a lot of the changes that we see in people are based in tone. Their posture is tone. Sometimes even their self-awareness is based on their muscle tone and the information that those muscles convey into the brain. So that's the main part where chiropractic comes into everything. And a lot of times I'll choose to adjust them on one side or the other based on what I want to achieve in their brain, in addition to what I find in my palpation or the other chiropractic tests that I do.
Okay, wow. So that was a great overview of what a functional neurologist, a chiropractor is thinking, is relating to the people that come into them, because I really want a prospective student to gain that insight that this is what's going through the head of a clinician, someone who's gone through the chiropractic education process and kept studying, kept learning, kept growing their understanding of how the central nervous system works, how the peripheral nervous system works, and how clinically they can help this really special population of children with neurodevelopmental and behavioral challenges, things that they are maybe just needing a little bit of support in a very unique and specific way. And you've studied exactly how to provide them the right thing at the right time, right? Because there's specific milestones for children, and you're able to really track progress based on pre and post measures. And it sounds like you have a lot of different measures. The education of the parent before they come into the practice sounds like it's very valuable. Can you speak a little bit about the culture? You live in Israel, you're a chiropractor. There's not a ton of chiropractors. Can you speak a little bit about what the community of chiropractors, and then specifically, you said there's barely any functional neurologists, but can you speak about what the profession, what the status of the profession is in Israel? Is it regulated? Is it unregulated? Is it recognized as a profession? What is being worked on? Where do you see it going in the future?
So I'm also the treasurer for the Israeli Chiropractic Society. We were deeply involved in that. There are about 120 chiropractors in Israel. About 70 to 75% of them are members of the ICS, and we are recognized. We are a profession. There's been legislation passed in 2010 that sets specific regulations as to who is considered a chiropractor. Unfortunately, for various political stuff, it's not actually being enforced or upheld right now. So we're still actually living based on previous legislation. But we are considered a healthcare profession. So if you would, as far as hierarchy goes, there's medicine. There you go. There's medicine, and then there's healthcare professions like OT, PT, speech therapist, podiatrists, chiropractors, and then below that there's like acupuncture, shiatsu, all of the other. I forget the name right now. Complementary medicine is what we call it here. So that's kind of hierarchy wise. So we are considered a healthcare profession on our own. You can come in off the street and get in our office. You don't need a referral from anyone. But it's still complicated. It's still complicated as far as legalities go, as far as healthcare insurance goes. So it's not exactly clear what's what. We're really hopeful that during 2021, it was supposed to happen in 2020, but then Corona happened. So we're really hopeful that during 2021, we're going to finalize all the legislation processes, and then licensure is going to start happening in a more organized manner, and things are going to start rolling from there. One of the things that I have promoted over the last 3 years, and I think have kind of caught on, was creating some Facebook and WhatsApp groups for us chiropractors to kind of, again, support each other, throw cases at each other, etc. So we have an ICS website, but we also have our own Chiropractors in Israel closed group that's open to people who want to come and practice in Israel or are practicing in Israel, but only for chiropractors. And then we have some WhatsApp groups. Some of them are more medically oriented and symptoms oriented, and others are more philosophically oriented. And I'm a part of both because I think both are important. You can't have one without the other and actually be kind of whole. You have to have both. It's a three-legged stool, right? You need to have that science, you need to have the philosophy, and then you need to have the actual technical ability to actually become a rounded chiropractor, the way I see it. And yeah, we only have about 2.5 people here practicing functional neurology. Actually, there's two, and then there's another guy who kind of took some classes, but he doesn't really do it. But sometimes he will. And interestingly, we both focus on children. So we do consult with each other sometimes. We do sometimes share cases and stuff like that. We have a couple of patients who have been back and forth, mostly for geographical reasons. So I'd say that's kind of the short answer to your question.
Sure. No, you're being clear. I think Israel is still in the beginning stages of developing infrastructure that could handle an influx of new chiropractors. I mean, my hope is that chiropractic students can recognize that you can practice anywhere in the world you want. If you become a chiropractor, you can go practice in Israel. And I want them to understand what it looks like to be in Israel. Do you have a group? Now you have a Facebook group. Now you have.
Let me just say one more thing. As soon as, because you did ask me about it and I didn't answer, the way the legislation is set up is so if a new chiropractor wants to come and practice in Israel, they're supposed to do a 6-month work under observation, and then they can get their license. If it's an older chiropractor who's been in practice for a while, then they can, they can apply to the Ministry of Health to get waived, to get that 6-month period waived on, if they've had a license for a while, 5 years, I think, or more. So that's just one thing, to consider. Right now, it's not being like you can come in and practice, but hopefully in the near future, that's going to be a program that's going to happen.
Can you speak for the lifestyle that it's given you? You have 4 kids, you have a family. Are you really enjoying being a chiropractor? You came all the way over to the States to study and then went back home to Israel. When you reflect back, was it a good decision? Are you really happy with what you're doing? Would you recommend this career path to somebody?
I'm not thinking because it's a tough answer. I'm thinking of how to say it. I am very happy with my choice. I think that it fits me perfectly. I think that it has changed the way I look at things, the way I think about life, about health, about decision making, about a whole lot of stuff, and I would definitely do it again. I would maybe do it a little differently. I would maybe make some different choices, but I would definitely do it again. One of the things I would do is instead of moving back home after 9 days after graduation, I would probably stay there for 6 months or so and work for another chiropractor. That's something I didn't do, and it cost me time to learn things on my own versus learning from someone else. So I strongly encourage people to be an apprentice, to be an associate. You don't have to start off on your own. Learn from people who've already been to where you are. Walk in giants' footsteps. Is that the right phrase?
Stand on the shoulders of the giants who came before you.
Yeah, something like that. Start your path on. Have someone help you, just like you start riding your bike using training wheels. You don't have to do it on your own. That's one of the things I would strongly recommend to someone, especially if they're going to functional neurology, because sometimes you need someone else who has seen an abnormal saccade 1,000 times to show you, hey, this is an abnormal saccade, and then you know what it looks like. Other than instead of learning it on your own, it just saves you on time and energy. That's one thing I would kind of change.
I think what I hear you say right there is some things can't be taught. You can sit in front of as many live streams as you want. You could sit in the classroom and learn, but yeah, everything can be learned, and that's where you learn it, is in the actual clinic that's seeing these types of cases.
Yep, you have to see it clinically, and it helps when someone else shows you what you're looking at. It can be with a leg difference. It could be what's a weak muscle. It could be an abnormal saccade or whatever. What's a tremor? What is considered normal? What's abnormal? What does an abnormal X-ray look like, etc. And then the reason I went to these dentistry and then chiropractic is because I knew I wanted to be there for my family. I wanted to be present. And I was hoping that this is going to be a profession that allows me to be present. And I think there's ways to do it, and there's various ways to do it to make sure that you work hours that are compatible with the hours that you want to spend at home with your family and make an honest living. You do have to figure out how to do it. Not everybody works the same. And that's the beauty of it. You can decide how you practice. You can decide how many hours. But you have to be willing to make sacrifices. So if you want to work only 5 hours a week, then you have to make those 5 hours count. If you want to work 50 hours a week, then, something else is going to suffer. Me personally, I decided how I want to work, and then I actually added another business to make sure that I have enough income to allow for those hours that I want to work. So it really, the flexibility is completely dependent on your choices, and you're willing to play around with everything in your life.
Totally. No, it's a great message. It's a very creative profession. You can be creative in any way you want. So, Omer, thank you so much for sharing your insights with us today. And I continue to follow you online and just see what you're doing over there in Israel. I'm very happy to be connected to people around the world who are practicing chiropractic, and to know that you were connected to the roots of chiropractic over here in the States, and then we're able to bring it to a community that appreciates it. You don't need to know too much to know that the central nervous system is connected to every aspect of your life. So
sure.
Anyway, thank you so much. Any last messages you want to share of things that you're looking forward to, that you're excited about, that are coming up in your life, that you want people to know about?
Well, this weekend there's the IAFNA conference. So if anyone's seeing this like in the next few days, you're welcome to sign up and join us. It's going to be interesting. I have 2 lectures that I've prepared for that, for the basic functional neurology course. There's that. And first of all, again, thanks for having me. I always love to talk about chiropractic and the brain, and especially talking to colleagues and friends. That's always fun and encouraging. And I strongly advise anyone who is considering chiropractic as a profession to do 2 things. One, like I said, go and learn neuroanatomy and neurochemistry. But more than that, go spend some time with a chiropractor. Go spend some time with 3 chiropractors. Go spend some time with people who do different things, different techniques, not because you're going to learn everything, but because you're going to get a taste of it and see if you feel attracted to it. And then remember that maybe when you get to college, you're going to decide that you're going to take a completely different path than what you've been exposed to, and that's okay. You don't have to be anybody else. Everybody else is already taken. Just be yourself.
Yes.
That's what I'd like to say.
That's our message. Just be yourself. Find your way. Follow your heart. Thank you, Omer.
Thanks, Ben.